Hi and welcome to the seventh in this series of introductions to the concept of hypnosis and the holistic approach. This one I'm going to talk about the therapeutic uses of hypnosis, and I'm going to introduce you to the British Society for Clinical and Academic Hypnosis. Now the foundation training is what I am recommending, and in this presentation I'm going to just go through some of the therapeutic uses that you will be introduced to in foundation training, and just above me here is the website, which is the bscah.com, and you will be able to find quite a lot of resources, and for anybody interested in resources that are there to help people who've had COVID and are stressed at home, there's quite a lot of information. So I'm going to just go on and now give you an introduction to the therapeutic uses that we have. So when we talk about hypnosis, I'm stressing this is hypnosis with a small h. Hypnosis is not a therapy. Hypnosis is a tool or technique, and in my view there is no such thing as hypnotherapy. Hypnotherapy is something that hypnotherapists do, and it's become a business, I think, rather than a healthcare thing, and it's something which is confusing the issue. There is less stage hypnosis around now, but there is more hypnotherapy, and in some ways it gets in the way of the medical and dental uses, and perhaps the pharmaceutical uses, and perhaps for physiotherapists. All these healthcare professions will benefit massively from using hypnosis as a tool, because it's there as a use to access the subconscious, controlling the physiology. Here's back to my complex screen, just as a reminder of what we're dealing with. So, the uses, I've just classified them here. One is to modify the perception of a sensory input, that is to reduce acute pain. Manage chronic pain. Chronic pain can be complex, and there's a lot of different factors in it which will be explained to you. It can also be used in labour and surgical interventions. And surgical interventions, particularly in dentistry, we can use hypnoanalgesia. And when you come on the course, you'll probably be shown some videos of actual surgical interventions, and you will be left in no doubt that it works very well, though it does require a certain amount of effort. And my own view is that it's a useful tool and an adjunct, but if you want to use just hypnoanalgesia to take teeth out or do surgical procedures, put implants in, you're probably better off using a combination of a very good anaesthetist and hypnosis as a tool. Then there's the modification of motor and autonomic output, and we can use this to control saliva and bleeding, anxiety. We can reduce the stress response. Irritable bowel syndrome, there's an awful lot of interest, and at the last Warrington course there was a consultant gastroenterologist from Croatia who came over to Warrington to get the training on using irritable bowel, using hypnosis as a tool to improve the outcomes for irritable bowel syndrome. So around the world there's an awful lot of interest, and although there's a lot of interest in expertise in the UK, the actual use of it in the health service is we may well be in the position where we have to catch up. This is the list of modification of motor and autonomic output. Then we can modify physiology, so inflammation, burns, eczema, asthma, increase in immune response. And the thing about the inflammation is that if you treat a person surgically, not only do they not bleed in the same way, they tend to ooze gently. They get less post-operative pain, they get less inflammation, less swelling, and the healing seems to be generally much better and less scar tissue. Patients who've been burnt, they can have their physiology changed by using hypnosis, and their outcomes are better. And there's the modification of psychological processes. People in hypnosis get significant time distortion, so you can reduce procedures which may take an hour down to the fact that they hardly notice that it's taken more than 5 or 10 minutes. And that, you can imagine, is useful in a lot of areas such as MRI scans that might take a long time. We can also do hallucination, which can be positive and negative. That's an interesting phenomenon rather than a use. Age regression and age progression, there are different techniques. From my point of view, we don't really think of age regression as being terribly useful, but time road, where we can get people to go back and review past experiences and reframe them, is a very, very useful and very common technique. We can access unconscious processes, and these are some of the areas that can be used by the psychologists and by general medical practitioners who've got an interest in that field. Habit disorders. Everything we do is a habit. From switching on the light as you go into a dark room, that's a habit, and it's triggered by the fact that you've gone in a dark room and you can't see anything and you would like to see something, so you switch the light on. Now, hypnosis is a tool in our toolbox for changing habits, and some habits are referred to as being bad and good. I don't really like that definition. I think of them as being either effective habits, which help what we do, or ineffective habits, which tend to get in the way. And sometimes what might be thought of as a bad habit is actually can be useful sometimes. And they can be used to correct underlying drivers. But when it comes to habit disorders, a lot of the time people want to introduce something into their life. For example, they might want to decide that they're going to use self-hypnosis in order to help reduce their anxiety, and they want to do it every day. So they can use this concept of habit stacking, where very often people will get up in the morning and you go downstairs. Take me, for example, I'll go downstairs, make a cup of tea, put the water on the tea bags, and then what I might say to myself is, after I put the water on the tea bags, I will sit down and I will do self-hypnosis for 3 minutes while the tea brews. I've got nothing else better to do, might as well do it. And you know what? 3 minutes is plenty to do a useful self-hypnosis or a meditation or whatever you want to do. And when you're doing that, you're habit stacking, because you always get up, you always go downstairs, open the door, get the teapot out, put the tea bags on, put the water on. That's the cue. Sit down. And using hypnosis can then effectively change your behaviour. You can use it for anxiety management, reduces the stress response, but there you can see management of poor sleep, and useful in reduction and stopping anxiolytics. And phobias, of course, spider phobias. We can also have coping strategies for other sort of phobic situations. Communication. We can use hypnosis to be able to help people have more effective communications with ourselves, talking to ourselves, and also with others. And increased observation of minimal cues, because we use anchors and cues, and they are very important in terms of our behaviour and our habits. We can get improved motivation and compliance. Very useful in training staff, as a matter of fact. Personal development. Here's emphasis on weight control, exercise routines, and habit development. hypnosis is very useful in creating internal belief systems which help us in all these areas. So people very often say, self-hypnosis, how long does it take? Well, the simple answer is it can take as long as you want. But if you're going to learn self-hypnosis, about 10 to 15 minutes a day for 4 weeks is you're going to become pretty good at it. After that, you can do it as often as you want. When we've taught you to do self-hypnosis, in general, you can go in to hypnosis and out of hypnosis anywhere between 45 seconds and a minute and a half, which is why I say that 3 minutes while the tea's brewing can be an effective time to relax yourself and sort yourself out of the day if you've been organised with self-hypnosis. So, for more information, you can get in touch with me, or you go to the British Society of Clinical Academic Hypnosis website. There are a lot of resources, and I'm encouraging you very enthusiastically to take part in the foundation training. This is the last of the presentations in this introduction, so I just want to conclude to say that I started off the introduction by introducing myself and my family, and I do actually just want to end up with my personal observations. I am now in my 70th year, and I want to remind you of these, that a lot of what I've been talking to are based on my internal beliefs. And with all the evidence that we've put forwards, with a lifetime of experience, I have come to believe that actually most people are well intentioned. But we are subject to the corrosive influence of bias, systematic distortions of thought, the power of rationalisation, the guises of self-interest are massive, but in the inevitability of unintended consequences. And we always have to be aware that for anything that we do, there may be an unintended consequence, and we have to stop, correct it, and go back and be really, really aware. And that's why I think you really have to have this holistic approach. Going back over my lifetime, back to my parents and uncles in the medical profession, Beveridge report of 1942 identified this, that the 5 barriers on the road to reconstruction were want, disease, ignorance, squalor and idleness, and the diseases and the disease drivers in 2020 are the same. They are poverty, social inequality, low educational attainment, stress and isolation, and they are caused by mismanaged emotions. And so very, very important that everybody in healthcare realises that mismanaged emotions are really important, and hypnosis, in my view, is an absolutely essential tool. The problem is, what do we do? Well, you can only start with the individual. So from my point of view, I started with the individual. We've introduced it into our practice. I would like to see it extended so that we can start using it in hospitals and organisations. I think that we need to get local government involved and understanding what we need to do. And the biggest benefit of all is if we could influence the ruling oligarchy, the triumvirate of people that come out and really just sort of mislead people. If we could just get them to understand that taking an holistic approach is important, then we may be able to influence the economy as well. So, this is a reminder of the presentations. We've now got to presentation number 7, and in the CPD, these are the other areas that I look at and we can develop. But most of all, I would like you to go to the British Society for Clinical and Academic Hypnosis website and think about enrolling for some training. So, thank you very much for listening.